The gentleman from Alabama is recognized for 5 minutes to question.
Well, thank you, Madam Chair. I truly appreciate your indulgence, Secretary Becerra. I've expressed this concern in other hearings, and I think we're facing a crisis of confidence in our nation, public confidence in many of our institutions. A lot of it has borne out of the handling of COVID. We've become even more divided as a nation, and it's impacting healthcare and the trust in healthcare. And what I want to ask you about, and I hate to do this, but HHS has just issued a Medicare physician's fee schedule final rule that includes a provision that will provide a financial incentive for doctors to create and implement an anti-racism plan. And that's raising a lot of concerns among people. And I just want to hear from you a little bit about how this is going to operate. And I'll tell you my concerns. I think it undermines public confidence in two ways. I think it raises questions in the minds of minorities that if they see a physician who's not of the same race or color, that they're not going to get quality care. And it undermines the confidence of people who are white, that they're going to be discriminated against. How would you address that?
Congressman, I want to be as thoughtful in my answer as you were in the question. First, we don't have a policy as you've described. Our policy is to try to tackle the disparities that we see in healthcare access. I could tell you the number of stories I've heard from women, mostly black women, who go in to get care and they're not believed when they say that they're in pain. There are people who have experienced, who because of sickle cell experience, deep pain when they present at an emergency room, aren't believed and don't get immediately the treatment that really should be provided to someone who's suffering from sickle cell disease. We know that this happens. To ignore it is to ignore a travesty in our system. We're simply trying to say that no one should be denied health care simply because the disparities that exist prevent you from getting the care you need. We're going to try to tackle those the best we can.
Yeah, we already have those rules. And by the way, one of my best friends, Dr. Tim Towns, was one of the leading researchers in the world at the University of Alabama, Birmingham on sickle cell research, and he's white. And he's devoted his entire career to that. And I want you to understand that there is a divide that's being created here that's going to further undermine public confidence. And we have to be extremely careful about how we address these, all of us, not just the Biden administration, but all of us.
I agree.
And it creates serious concerns that you know, if you go into a doctor's office and you think if you put down you're white, you're going to be.
But Congressman, to that point, if you'll permit me, much of this is driven by the mis and disinformation. I would challenge you to show me where in our policies we call anything we're doing anti-racism policies. We're simply trying to make sure everyone has equal access to health care.
If there are doctors out there that are discriminating against anybody for any reason, they need to be dealt with in another manner, because that is totally unacceptable. Totally unacceptable.
Agree with you.
So I just want to raise that point, let you know that this is an issue. There are people out there that have raised concerns to me about it, and I intend to address it further at the appropriate time. But I do appreciate very much you answering the question and your assurances that it is not the intent of HHS to discriminate against anyone. I will hold you to that. And also, again, I sincerely appreciate you staying 30 minutes past the original time that you said you'd give us. And with that, Madam Chairman, I will yield the remainder of my time.
The gentleman yields back the remainder of his time.